sessions here, Dr. Anil ji and my co-panelist Madhurunyal ji and Sunita ji and all other participants here. Namaskar to all. So it is with a great honor and responsibility that I am standing here to represent what Sewa International does in public health. And at the outset, I would like to clarify two things. One, whatever I am going to say in the next 10 minutes, it is going to be purely a practitioner's perspective as a professional social worker, what we does in this particular sector. And second, all the things that I am going to tell or all the things that I am going to present, all this is possible because of the hard work of the frontline workers, the professional health team, the management, the donor, the partner, on whose shoulder I am standing here and presenting to you. So first, to let all of you know what exactly is Sewa's approach in public health. So Sewa's approach in public health lies on a couple of pillars. A, it is always community centric. And by community centric, what we aspire is to create a demand driven healthcare model rather than a supply led one. Second, this particular idea is complemented by something that we aspire is it will be both integrative and holistic. By holistic, we want to integrate all the different fields of medical science, all the different fields of healthcare. And by integrative, what I mean is that we all know public health is largely determined by, there are a lot of social determinants of health also. So we work on a lot of social determinants of health also to kind of complement this particular thing. And by this social determinant of health, I mean it could be wash, it could be helping people to earn the income more, their housing, their ecosystem and everything of that sort. Third, there is a special focus that we give on some high risk category. It could be women, children, adolescent girls, Vanvasi people, and also a specific focus is also given to the border and strategic location across India. And fourth, we also have this approach of PPP. And by PPP, I mean partnership for public purpose. So this is the idea with which we work. So we partner with all like-minded organizations, governmental entities, the schemes that are present now, the policies there of Government of India, be it TB Mukt Bharat, Anemia Mukt Bharat, Netra Jyoti Abhiyan. So we try to align our all activities in this way. So these are the couple of approaches that we are following in all our interventions. And with respect to presenting the portfolio of our kind of work that we do, in the curative health, we have a specific set of intervention. One, we run mobile medical units. And each of these mobile medical unit is equipped with a fully fledged medical team, a lab technician, a doctor, a X-ray technician. It has a 10-member team. And as of today, we are operating 3 MMUs and a couple of MMUs are already lined up. And these MMUs go around the different far to least villages and provide the healthcare delivery. And secondly, within the curative services, we also operate telemedicine and e-health centers across Uttarakhand. And also from Delhi, during the COVID, we were operating telemedicine as a major thing. And second, beyond the curative health, we work on a major pillar of strengthening the public systems. By strengthening the public system, we work in 2 ways. A, we try to augment the hard care infrastructure by kind of augmenting the hospitals, the PHCs and CSCs. So I would like to share that we had probably installed 30 oxygen plants across India. Because if you know, during the COVID, there was a huge shortage of hope. And around 10,000 to 15,000 oxygen concentrators were also provided to these hospitals. And we had specifically also worked with 9 to 10 PHCs and CHCs in Surendranagar district to kind of augment them. And beyond that, there is also this particular component to work on the soft skill side of the soft infrastructure side, where we try to also capacity build the ASHA, the ANM and Anganwadi to respond to that particular situation. And the third kind of pillar that I would like to touch upon is the preventive way in which we are working. And under preventive way, a major intervention is on WASH. So we have a dedicated program about which I will touch upon after some time, which is called SHE. SHE is sanitation, hygiene and empowerment for girl child. So this is one initiative on WASH that we particularly focus on. Second is something that we call adolescent girls group. So we brand it as Ladli. And through these adolescent girls group, we kind of set awareness, anemia prevention, all those activities are going through in that way. And also there is a third activity at the community level, which we are calling mutual health organization. एंड इन हिंदी स्वास्थ्य सेवा समिति बोलता है हम, ये हर गांव में होता है, तो उनको हम आर्ग्यूमेंट करता है, उनको हम सपोर्ट करता है, उस माध्यम से उनका प्रिवेंटिव लेवल का काम होता है. और हमारा मेजर फोकस एरिया, ऑल दीज एक्टिविटीज़ दैट आई मेंशन, आवर मेजर फोकस एरिया इज हाउ सेवा इंटरनेशनल बिकम्स द फर्स्ट रेस्पॉन्डर बाय डिफॉल्ट ड्यूरिंग एनी डिजास्टर. By actually providing these kind of activities. So I am very humbly saying, but I am very proud to say, wherever disaster has happened, be it the 2013 Kedarnath flood or the Tapovan rainy glacial outburst or the recent Joshimath incident, Himachal flood, Sikkim, we have been providing healthcare delivery by deploying our MMU, by supplying essential medicines, and also by supplying health and hygiene kits in that way. So this is the core intervention in which that our entire activities are going on. So these are the set of portfolios that I would like to kind of highlight what Sewa does. And as a flagship initiative, I would like to also kind of take your attention to two specific initiatives. So this mobile medical unit is one of the initiatives that I would like to. So probably Madhurji also touched upon that particular challenge, especially in the Himalayan region. Accessibility through road is a big problem, and accessibility plus there is also of professionalized accessibility as a big problem. So these MMUs or the mobile medical units that we are running, these are fully equipped both in the kind of the soft skill way where we have good full-fledged team, and in the hard way where it kind of provides around 70 to 75 plus diagnostic tests in one vehicle. It has an ECG machine, it has an X-ray machine, and it goes around 25 to 26 locations on every month. And these three MMUs combined, put together, probably we are serving around 70 to 75,000 OPD on a yearly basis. And I would also like to kind of highlight that we, for this particular MMU, were awarded the SDG 3 Goalkeeper Award by the government of Uttarakhand last year. And this is one initiative in which I would like to highlight. And by investment, if you talk about the investment, it is a mere investment. It comes to less than 500 rupees per person. Over the year, this kind of a treatment can be pulled off. The second initiative that I would like to also kind of highlight is of SHE. So SHE is this particular dedicated program that we are running on WASH. So there are three components under this particular program. On SHE, we work on kind of sanitation as a major component. Under sanitation, we try to help government schools to have clean toilets and hand wash stations. So over the years, probably we would have worked with around 1,500 such schools all over India. Second, menstrual hygiene management is also a core area in which that we are working. And on menstrual hygiene management, we work both on awareness generation, by educating them on what menstrual management is all about, and also by supplying menstrual management kits and all. So around 1 lakh to 2 lakh particular adolescent girls has been outreached to this particular initiative. So this is the second kind of initiative. Third one is on empowerment, where we also know one thing, that despite having all those things that we are supplying, there should be a demand side of things that should be created. So for empowerment, there are specific personality developmental trainings that happens on a month-to-month basis under this particular program across all adolescent girls. So these are the two flagship initiatives also I would like to highlight from Sewa International's point of view. And before closing, I would like my communication team to present a short documentary on the MMU, which we run in Uttarakhand. And this was sponsored by Oracle, and I would also like to thank Oracle for sponsoring this particular initiative. So I would like all the audience to pay attention to this particular documentary, and thank you for listening to me. Jai Hind.
Primary health kits, nutrition camps for adolescent girls and women,